Hello, everybody. My name's Sue Dobson. I'm a professor in organisational behaviour here at the Sci Business School and serve as Deputy Dean at the school. Welcome to the latest in a series of events and conversations facilitated by the school that we've called Leadership in Extraordinary Times. Today, I'm joined by Peter Drobeck and Eleanor Murray, both colleagues at the school, to discuss COVID-19 and in particular to explore the issues of preparedness, resilience, and indeed the future of public health. A word about the format. As moderator, I will ask the experts some questions and seek to draw out their knowledge and research in relation to those questions. And then there'll be plenty of opportunity for you to ask questions, which I will try and feed in as we go along, but we'll make sure we have time at the end. So thank you in advance for the questions. Let me say a brief word about the thinking behind the series, Leadership in Extraordinary Times. We find ourselves in extraordinary times, coping with the twin systemic challenges of the pandemic and severe economic disruption that's devastating our society, global trade, and indeed our family lives. We will need, it's quite clear we will need, more different kinds of thinking. We need to reflect more systemically, lead more adaptively, and experiment more in our practices. This series was the business school's attempt to think about these issues, drawing on research that's going on currently in the school, and indeed the work of leadership development with our executive education colleagues. So for this session, we're looking at COVID-19, preparedness, resilience, and the future of public health. My two colleagues I want to introduce very briefly before we begin the session. Peter Drobeck from the business school, a global health physician and social entrepreneur. Peter is the director of the Skoll Centre for Social Entrepreneurship. It provides an opportunity to do research in this space. It leads to actionable insights, and importantly, to its heart, it creates a community for social entrepreneur and innovation. For over a decade before joining the business school, Peter played a key role transforming Rwanda's health system and is a world-renowned scholar in implementation science. Eleanor Murray is a senior fellow in management practice at the school. Her research area involves exploring large-scale change processes in the UK and internationally, especially focusing on the challenge of delivering integrated healthcare systems. Eleanor has extensive experience in the health sector as a leader, and this experience means that she's very well placed as a researcher to explore organisational resilience. And this is Eleanor's key research area. And indeed, she gives many, many sessions in our executive education leadership programs on this topic. So welcome to you both. So if I may start then, how on earth did we get here? So Peter, from a public health perspective, what's new about this virus? And maybe give us a bit of an overview about how it's impacting globally.
Sure. So many of us in global health have been saying for a long time that a global pandemic is not a matter of if, but when. We've seen a number of epidemics that have become global threats over the last couple of decades. You know, they've been around sort of as long as time, but the frequency with which we're seeing emerging infectious diseases has been increasing. And this is because of globalization, urbanization, and climate change. So many of us predicted it. Of course, you just never know exactly which pathogen and exactly when it's going to happen. And obviously, we were all caught somewhat by surprise when this novel coronavirus really swept the globe. So just to refresh everyone's memories, this is a virus that appeared to jump over from some animal species, we're not sure which, into humans in a place called Wuhan, China. And that emerged, we think, in November or so of last year, of 2019. And over the course of then December, there was a cluster of sort of mysterious pneumonias in and around Wuhan that were bringing people down. By the end of the month, a new species of coronavirus had been detected, new for humans, and within a couple of weeks, actually, its genetic sequence was completed and then published with around the world. Since then, unfortunately, we saw a dramatic spread across China and then across the world. And it's really remarkable when you think that this is something that's only been with us for a few months. And at the moment, we're looking at about 1.5 million cases in almost every country on the planet and over 80,000 deaths. What sets this apart is that, first of all, there's no immunity. None of us have any immunity to this particular virus because it's new. And so there's no protection kind of built in. It appears to be extremely contagious or infectious, really much like influenza, which affects, tens of millions of people every year because it is so contagious. And importantly, it seems to spread even before a person starts having symptoms. And so even if you're trying to test and isolate people once they start to get sick, they may have already infected other people. We've seen interesting responses in different parts of the world. Some countries have been very successful in sort of stemming the tide and beating back the tide of this virus, and others, of course, have done just the opposite. China ultimately implemented an unprecedented lockdown, the probably largest and strictest in modern history, where hundreds of millions of people were essentially on a very strict lockdown, and that's a blunt instrument, but was successful. Other countries in the region, like South Korea and Singapore, were able to use widespread testing and really smart public health measures to nip things in the bud before they got out of hand. And all of those are countries that were kind of on high alert because of SARS, a similar epidemic that hit us about 15 years ago. In the West, we were really caught flat-footed, and I think it'll be interesting for us to explore kind of what happened and what went wrong. There was a sense of otherness, and it was too far away, and there wasn't a chance it was going to come over here. When you look back, all the warning signs were there in January that this had all the makings of a real pandemic, the potential to spread globally. And when in the US and the UK and much of Europe, we should have been preparing and buying ourselves time, unfortunately, we were downplaying the risks, and that's really come back to bite us. What we see is this kind of exponential acceleration in the number of cases. So rather than going from 10 to 20 to 30, you go from 10 to hundreds to thousands to tens of thousands and so on. And we're kind of in the grip of that right now. So at the moment, over half the world's population is in some form of lockdown to try to control this by just keeping people physically apart from one another, which is not the only way to do it, but it is kind of an extreme measure of last resort to try to save millions of lives. Of course, that comes with enormous consequences, and we've seen obviously a massive shutdown of most major economies around the world as global trade has shut down, as businesses have been shuttered, and many, many jobs have been lost.
So if I could just push you a little bit more about what were the factors that led to the impact that we're seeing today. If you could highlight those for us, that would be very helpful.
Sure. So what normally should be done, and what 100 years of public health practice would tell us, and the lessons from the countries that did this well early on in January, is that when you start to see cases, that widespread testing everybody with symptoms and isolating them, and then finding out all the people that they've been in contact with in the previous couple of weeks, and testing and following them and pulling them out of circulation, can break chains of transmission. And you're able to actually trace chains of transmission from person to person to person. When you can do that successfully, you can interrupt those chains of transmission. You can also understand where the hotspots of infection are. In South Korea, for example, they didn't have to shut down the entire country because they were able to identify specific localities, specific schools, or specific hotspots, and try to cordon those areas off without these kind of blunt instruments. Unfortunately, here in the UK, we didn't do that. The US, of course, famously had a big sort of cock up with the development of their own tests rather than using other tests, and got about 2 months behind. So what happened was the genie kind of escaped the bottle, and we saw widespread community transmission before we really got our public health systems up and running. And so what this suggests is that we just didn't have the preparedness that we needed to do so. What you need is that surveillance and early detection response where the infrastructure and the tracking systems and the surveillance systems are already in place so that you can spring into action at the early signs. And it's remarkable that in the wealthiest countries in the world, and the US has the most expensive healthcare system in the world, that such things didn't exist.
Okay, thank you. And then if we can just turn to you now from a kind of more business perspective, how do we get into this situation in terms of business collapse, employment fears, etc., that we're feeling today?
Yes, so Peter, thanks for that overview, and hello to everyone on the call. So most businesses do have some sort of business continuity plan to respond to a range of threats, whether it's from natural disasters to cyber attacks. But as Peter said, in this situation, the reality is that most business continuity plans just simply weren't sufficient for the scale and the duration of this pandemic as we're seeing it unfold. And as Peter's saying, this is partly because the pandemic, this sort of level of severe pandemic, was last seen in 1918 to 19, over 100 years ago. And subsequent pandemics that we've had in 1957 and 1968, and the most recent one, the H1N1 pandemic in 2009, did have lower mortality rates. And so I think businesses tend to plan with what's in their living memory in terms of looking back and seeing what they can actually remember and plan around that. And so just simply the anticipation of the consequence of the level of contagion of the virus wasn't anticipated. So I think in some ways we are dealing with a once-in-a-century crisis, which is likely to have a very profound economic impact, but we haven't, but because of the lack of planning that Peter's alluded to, we haven't been able to anticipate and prepare sufficiently, although some countries have managed that. So we've witnessed this partly with the physical distancing we've seen, which has imposed lockdowns through over 70 countries, which has affected 2.5 billion people. And this has had, just through the nature of the restrictions on travel, it's had a huge impact on the aviation and tourism industries, and the restrictions of movements, of people's movements, have affected most other sectors, particularly retail, manufacturing and the hospitality industries. And I think we are beginning to see the effect on the resilience of the labour market. So as businesses are starting to lay off employees, the unemployment claims are beginning to rise. We know that in the US, there have been the highest reported figure of 3.3 million unemployment claims just in 1 week. And here in the UK, we've had nearly 1 million claims for universal credit in the last fortnight. So although we know that European governments have provided some support packages with loans and tax relief, they haven't necessarily been sufficient for small and medium-sized businesses who may be particularly affected because of their limited cash flow, and they may not be able to access the government funds quickly enough. So it's potentially creating a really problematic situation for business generally.
Indeed. And in your experience, I mean, how prepared are businesses for crises generally, and specifically for one of this magnitude?
I think we've seen the full spectrum of business preparedness in response to this crisis. Some businesses that were already facing difficulties and failing to cope with the challenging market conditions have already gone into administration and become early casualties of the pandemic. Other business sectors, particularly aviation and tourism and hospitality and fashion, are experiencing significant challenges as trade slows down owing to the number of people in lockdowns. And they're going to be looking to government support to help them through. But we have seen other businesses really rapidly reorientate themselves, showing remarkable sort of foresight and adaptability, embracing digital technologies to support working at home or alternative manufacturing processes like 3D printing. And these businesses have rapidly been able to reorientate their business models to meet immediate needs such as food supply, protective equipment, medical equipment that are needed in this pandemic. And we've seen some really adaptive practices. We've seen entrepreneurs providing open source designs for some of this equipment, large corporates getting involved. We've seen, for example, Dyson transitioning from vacuum cleaners to ventilators. We've seen LVMH, the French perfumier, distilling hand sanitizer. And we've seen Gap and Ralph Lauren making medical gowns and face masks. So we have seen really both aspects of a business response and levels of preparedness.
Okay, thank you. So before we look at what needs to happen, I've just got a question here specifically for Peter. Nigel in the UK asked, Peter, as a health professional, can you help put the deaths infection in perspective of annual flu deaths generally, general daily mortality rates, even just for the UK? So there's just a notion about perspective there, and then we'll move on to think about what we need to do. Thank you.
Sure. So all of our kind of estimates with this novel coronavirus are in flux, and so take them all with a grain of salt. They appear to be roughly similar in terms of how infectious they are. In general, what we see is that every person with coronavirus tends to infect about 3 others during the course of their illness on average, which is why we see that exponential growth. In terms of mortality or case fatality rates, with flu, it's about 0.1% of people infected ultimately pass away, which is quite low. And so we see an extraordinary number of cases every year seasonally, in a modest percentage of deaths, but it ends up being quite a large number. In the UK, it's on average about 17,000 deaths per year in a country of about 66 million. To then put that in context with what we're seeing at the moment in the UK, and we're still kind of on the upswing in terms of where this epidemic is in the UK. We've already had about 8,000 deaths. If this were to spread through the entire population and affect about 2/3 or so, which is what we expect would happen without control measures, then even in the best case scenario, estimating somewhere between 0.5% and 3% death rates, it's varied from place to place thus far, we'd be looking at 250,000 to 500,000 deaths, possibly even higher than that. So it puts it in perspective, actually, this could be an order of magnitude more severe, even in the short term, if we didn't do a lot of the things that we're doing right now to try to bring things under control.
Okay, thank you for that. Let's move on then to having explored how we got here. How can we get out of this? You mentioned, Peter, that we're all in lockdown and desperately anxious situation. What needs to happen from a public health perspective to get us out of this?
It's not going to be easy, first off.
No, I'm sure.
Lockdown is not a solution. Lockdown is a blunt instrument to buy us time, right? This protects our health services from getting overwhelmed, and that would, of course, drive mortality up even further and cause all other kinds of casualties, and then gives us time to make a plan for how to get out of this. So one of the things we need to bear in mind is that the ultimate solution may only come when we have a vaccine against this virus. There's never been a vaccine against any coronavirus thus far. Guinness Book of World Records time for a new vaccine developed from start to finish is probably about 5 years. We're anticipating 12 to 18 months here if all goes well. There's an extraordinary effort underway to look at both vaccines and treatments. So what we really need to start thinking about is a plan for what's going to happen over the next approximately 12 to 18 months where we can keep this under control. Because if we relax too soon, there's a very high risk of a second surge in infections, just as there was with Spanish flu 100 years ago. But we can't go on like this either. The impacts will be extraordinary if we remained in lockdown for months and months and months. So we're going to need to be able to find some kind of middle ground to begin to open up. And we're getting lessons from the places that are a bit ahead of us: South Korea, Singapore, Taiwan, Hong Kong, and now China. Wuhan actually ended its lockdown a couple of days ago after 11 weeks of a much more severe lockdown than we have here. So what does it entail briefly? Testing, testing, testing. You have to go back to first principles and say, we need to be able to get every single person who might be positive tested and out of circulation, follow their contacts, etc. That's going to be extremely important. A second piece is going to be finding ways to measure who might have immunity, some degree of immunity, from having already had and recovered from infection. We don't know exactly how good that immunity is or how long it lasts, but there's good reason to think that if you've had it and recovered, you're not at risk of getting it again in the short term. So all the people who have been infected maybe then can go back to work, and that's especially important for health workers and other key workers. So those are some of the things that we're going to need to do, but I think it's fair to say, I can't say how long the actual lockdown is going to go for. I do anticipate that in the UK anyways, that'll continue for at least another several weeks, but we're not going to get back to normal kinds of free movements, fully open travel and economy anytime soon. I think it's going to be a little bit of a learning process.
Okay, thank you. Eleanor, let's move on now to look at a business perspective and a health system perspective, if I may as well. How can businesses get out of this? What do they need to do?
Well, I think businesses face significant challenges. We know that consumer spending power is likely to be constrained as a result of all the layoffs. There may be further waves of the pandemic if our exits from lockdown is not managed carefully, as Peter's mentioned. And we know that global supply chains may take time to recover because of border controls and factory closures. So a key finding from my research on resilience is that businesses don't tend to bounce back. Although the temptation for businesses is to revert to business as usual before the crisis, so go back to pre-crisis conditions, the reality is if they're truly resilient, they're likely to bounce forward by integrating learning from the crisis into their everyday operations, and also having the capacity and the capability to adapt in anticipation of what the new economic environment is likely to look like. I think we can expect it to look quite different, with the potential economic impact and the likelihood for a downturn as well. So I think one of the challenges for business leaders is to balance coping with the day-to-day pressures of the crisis, which might include sort of providing responsive leadership to many stakeholders, or dealing with immediate operational issues, with an anticipatory approach that tries to look forward amidst all the uncertainty, and tries to spot new opportunities or experimentation, or collaborations that might help them to build new business in the face of a new sort of certainty. And we've seen this in this crisis with the the rapid adoption of new technologies across the globe to support remote working, such as Zoom and Microsoft Teams, and rapid manufacturing techniques such as 3D printing. So one of the challenges for organisations is, can they capitalise on the use of some of these digital technologies and some of the new innovations that have come out of this crisis in terms of building their business going forward.
Okay, thank you. And just thinking about your knowledge and drawing on your knowledge and expertise about how healthcare is organised, how might the organisation of healthcare have to change?
I think one of the features of this crisis is that, certainly hearing directly from healthcare workers, is that the crisis is in some ways greatly reduced the amount of bureaucracy and silo working that tends to be evident in healthcare when it's functioning in a sort of routine setting. And it's actually enabled really rapid improvements to take place that couldn't have been thought possible in normal everyday operations. So we've seen some really positive steps. We've seen GPs moving to telephone consultations, which is something that was potentially quite problematic for some GPs in the past. We've seen the rapid creation of new capacity through temporary facilities, such as the UK Nightingale Hospital and the other hospitals that are rapidly being built. And the rapid expansion of the workforce with recent retirees and final year medical and nursing students. So, but however, other aspects for healthcare seem to be more problematic. Peter's referred to the fact that there's been significant bureaucratic constraints in the rapid scaling up of testing, and the ability to move protective equipment to where it's needed has been problematic. So the supply chain's not necessarily working as well as they could do. And although we know that there's been rapid scaling up of prototype ventilators, which has been very impressive with new collaborations happening, these may not get to the front line in time for the peak of the crisis. So I think in the longer term, the learning that can be taken from this is that the organisation of healthcare needs to become less bureaucratic. There needs to be greater encouragement of small-scale experimentation, and the developing these sort of collaborations across traditional boundaries such as primary and secondary care, and really embracing technological solutions, which has happened in pockets but has not been universally applicable in healthcare. So I think the crisis has forced healthcare leaders to look at adopting these new technologies, where previously there was this really significant bureaucracy preventing their adoption.
Okay, great. So question for you both. Obviously this is called Leadership in Extraordinary Times. I wondered if you could both comment from your different perspectives about what are the lessons for leaders generally, particularly in your perspective of public health and business. So what are the lessons? Peter, do you want to start?
Sure. I think one of the things I reflect on every single day is that even though it seems obvious, it's in times of crisis that you see how important leadership is, and looking at the different kinds of responses and different outcomes in different places, it's been evident. I think there's real correlation. You look at the difference between South Korea, between New Zealand, for example, where there was strong a credible government with high levels of trust, but also a strong, transparent face to this, and I think a really transparent decision-making process that brings people together, right? One thing that's very clear is that a pandemic response can't be all top-down. It actually requires collective action. We're all making sacrifices right now by staying in our homes and sacrificing economic activity and many, many other things. And so we need to be able to buy in that someone's got our backs and that we know this is going to work and that it's going to be worth it. You contrast that with, for example, the US, where the administration, the president there, ultimately denied this, called it a hoax, get up in front of the television cameras every day and kind of spew misinformation, and didn't actually take charge in a way that says we need a coordinated national response to protect people. And that led to this kind of, patchwork system where there was almost a race to the bottom, and 50 states are actually competing with one another for scarce resources. It's really been, bungled, and that very much, I think, goes back to leadership. I think this kind of crisis shows that in the 21st century, everything is interconnected, right? And problems like this and a lot of other challenges that we face, this is a dress rehearsal for climate change and lots of other big, wicked problems. These are problems that transcend any one organization or business or country to tackle on their own. So the best leaders are able to work both within their organizations, but also beyond them and build coalitions together. And that's what we ultimately need to see here.
Okay, thank you. Eleanor.
Yeah, so I think in terms of encouraging leaders to be resilient in crises, firstly, I think it's important for leaders to remain curious and not shut down their thinking too soon, really remain open to emerging conditions. I think secondly, they need to really, as Peter says, utilise their networks and not just work within their organisation, but beyond the organisation, utilising their networks to, as you say, build coalitions. And engage not just with their employees, but also with their broader stakeholders. We might include investors and customers and the wider public. So really keep all lines of communication open and explain as best as they can where they're going, even though times are uncertain. And I think third, they need to take really decisive action based on the best evidence available. We've noticed that leaders who have taken time in making decisions or haven't been sufficiently adaptive quick enough, where the businesses have tended to fail or do less well. So taking decisive action and also coping with the sort of apparently two inconsistent sort of approaches. So sort of a paradox situation, coping with paradox and being able to balance seemingly inconsistent or contradictory factors at the same time, because in this sort of complexity that we're seeing, you often need to somehow make sense of two very contradictory issues.
Okay, we've got quite a lot of questions. I think I'm going to just pause a little bit and just field some questions here that we've got. So David Pearson asks, what best practice measures by government response so far are there for balancing control of the virus and continuance of economic activity? So I think that's an interesting one for both of you. So best practice measures so far for balancing this control and continuance of economic activity. Peter.
Sure, I'll start. I think the first thing is that it feels like maybe there's a trade-off between saving lives and saving the economy. I don't believe that to be the case. I think if we were to let this go and have the loss of life increase even further, it would destroy the stock market and it would destroy the economy even further. So I think it's a false choice. That said, we're of course inflicting real economic pain with the response that we're forced into. So to me, the first big lesson is that early and decisive action and even preparedness is really critical, because this was not inevitable. Where we are in the UK, in the US, in much of Europe, in India, with lockdowns was not necessarily inevitable. Sweden never had Sweden had a partial lockdown. South Korea never had a lockdown. Singapore never had a lockdown, etc. And so it is possible actually to address and to contain an outbreak like this and not sort of get to this point. So that's, I think, the first and most important thing. I'll pause there and let Eleanor have a crack at the question.
Yeah, so I think, I agree with that. And I think the strategies that Singapore and South Korea have adopted in terms of a very rigorous testing approach as best practice seems to be the approach that's prevented the need for such constraints around lockdown. And I think that's where the preparedness factors have been problematic in being able to scale up the testing to the extent that they have needed to. And I'm not totally sure of all the reasons for that, but I think probably the fact that it's highly regulated and there's potentially quite a lot of bureaucracy around that might have made it harder to actually scale up quicker. But certainly those countries have demonstrated what can be done with a really effective best practice testing approach, and it's enabled them. I mean, obviously, as to Peter's point about interconnectedness, because all the other countries are in lockdown, that's affecting their business and their economic approach. But yes, but at least that approach is preventing this need for massive quarantine approaches.
Okay, thank you. Peter's question for you. Babshani, apologies for the pronunciation, from Nigeria. Question for Peter. What are your thoughts about the comparatively low number of reported cases in Africa?
This is really interesting. I don't know why yet. I don't think anybody does. I wasn't quite expecting this. Many of us early on were really fearful of the potential for this pandemic to hit sub-Saharan Africa in particular. In many countries in that region, of course, the capacity for sort of advanced intensive medical care is pretty limited. Countries like Liberia have just a handful of ventilators in the entire country. So if you were to see a big outbreak with thousands of cases, the mortality rates could be extraordinary. And that's something that I think we all still worry about. Why are the cases low up until now? First off, some of it might be artificial because testing until recently has been fairly limited, and even countries that have been working really hard at this and collaborating with China and elsewhere to get resources have not been testing as much as they would like. So it's possible there are more cases out there than we know about. Other possibilities have to do potentially with sort of climate, but again, in other warm weather places like the Middle East, we've seen a very significant outbreak, so I don't really buy that. In the Southern Hemisphere, cases are starting to go up as they move into winter. The relatively younger distribution of the population, about half the population of many countries being under 18 or 25, might have something to do with it, because we know that younger people tend to be less affected and often are kind of asymptomatic. But when you get right down to it, I don't think anything explains it all or that we're out of the woods. I think, frankly, we're still very much early on in kind of the epidemic curve in many parts of sub-Saharan Africa, and really need to remain vigilant, because I think that we're going to start to see a real significant rise in cases. Last thing I would say, we've talked about the consequences of the lockdown economically, but imagine how difficult it is to do the kinds of social distancing we've been all asked to do. If you're a family living in extreme poverty, really on the margins where you don't know where your next meal is coming from, it's not so easy just to stay home then. So the other real risk we, I think, face in Africa, if these kinds of measures need to be kept in place, is a whole lot of other suffering and starvation and potentially social unrest unless governments are able to step in and provide a safety net.
Okay, thank you. Question here about technology. Will technology help us to map and monitor the spread of future and potential pandemics? Eleanor, do you want to start with this one?
Yeah, so I think one of the issues is that we are able to map and monitor the spread of future pandemics to some extent. We've been able to do that in this pandemic. We have known, we've had reported cases coming out of each country, and that there have been, we've got league tables almost of, the numbers of cases per country and when they happened. I think the key issue really around this is technology around testing. If that can be made, if testing can be made more readily available, and that can be scaled up quicker, then that would actually help us to monitor the spread of future pandemics more than just technology in terms of reporting cases. That would be my sense, Peter, but Peter may have a different view.
Yeah, I think absolutely. And what we see underway is a kind of Manhattan Project to nuke the virus. You know, most research labs around the world have shut down because everything else is shut down. And so everybody who can is working on COVID-19 right now, or the virus that causes COVID-19. And so we're seeing the most extraordinary kind of R&D global effort that I think we've probably ever seen, certainly in our lifetimes, to attack this one thing. And so this means dozens and dozens of different kinds of vaccines are being developed, some of them quite novel and cool, you know, designed based on simply from the genetic sequence. I could go into it, but there's amazing work that's being done on that side. The other thing that I would say is if we want to get to how to prevent the next pandemic, there is work that we should do leveraging technology to be able to be predictive, not just in surveillance, but actually looking at what viruses are out there in animals that are high risk to jump over into humans. And can we start studying those pathogens now and begin to even develop prototype vaccines and treatments and be able to monitor for those things? So if we really made the investment, we absolutely have the scientific know-how to do it.
Okay. There's a couple of questions here, interestingly, about asking for comments about comparing the UK to the Swedish response. I don't know who would like to. There's several questions on that, so I think it would be nice to have a comment on that. Peter, have you got a view on that?
I'm not super current on exactly what's happened in Sweden. I know that they had also kind of a slow start, but they've resisted a total lockdown. And they have quite a bit of social distancing, but their lockdowns have been kind of regional and partial, as I understand it. But I'm not totally briefed on the current situation. I don't know if I can comment further.
Okay, Eleanor, same.
Yeah, I mean, I know to some extent that I think some of the lockdowns has been in more urban areas, and that because the population is maybe less dense,
Yeah.
it's meant that there has been more physical distancing possible than is required necessarily by needing a full lockdown. But yes, that's as far as I would be able to comment.
That's okay. The question here about how do we decide between lives saved now through lockdown measures and the lives that might be lost as a result of a severe global economic recession. So I think that's an interesting, important and interesting, difficult trade-off. Eleanor, do you want to?
Yes, I mean, I think the signs are there that we are heading towards an economic recession. In terms of the unemployment situation, in terms of the difficulties that businesses are finding around cash flow, around lack of customers, and the difficulty of trying to adapt rapidly. So whether lives will be lost in terms of that, I don't think I would be able to comment on that, but certainly livelihoods will significantly be affected, I think, through a major economic recession. And it is a difficult balancing act. I think once you're in the situation of lockdown, as the only response that you can have because of a lack of testing, a lack of adequate scaling up of testing, then it's hard to actually pull out of that, because you've got to manage the exit from lockdown very carefully to avoid these further waves of the pandemic happening. And so I think that will be a very difficult balance for governments to manage.
Thank you. Peter, anything to add to that?
It's incredibly difficult, but I also think it's a false choice, right? I think if you pull back on trying to save lives, you're going to hurt the economy even further. Early on here in the UK, from what we understand about the decision-making process, was that there was a lot of worry about being able to maintain social distancing and about some of the economic effects, and that perhaps we could manage a sort of controlled spread of the infection through the population to build up some population-level immunity. And I think as further facts emerged, it became very clear that the human toll would be so great that that just wouldn't be acceptable, talking about hundreds of thousands of casualties, but also that any, the economic sort of catastrophe would be even worse. And so I think that's, certainly the case right now. The only time we see the stock market ticking up is when you actually have some good signs that countries are getting this right, and you're starting to see flattening of the curve. So I think in the short term, we unfortunately have no choice. Where it's really going to get interesting and challenging, and I think nobody exactly knows, is going to be figuring out how we can begin to safely move out of the quote unquote lockdown and do that safely.
Okay. A question from Gail Conman in Melbourne, and she asks, are there some key collaborations we should seek to support as we move beyond the pandemic? So the notion, what can we learn about the collaborations keep going forward? Peter, do you want to?
Sure. One of the things that's really disturbed me through this response, and even though for the last hour I've been comparing this country to that country, is if you take a step back, right, the virus doesn't respect national boundaries. It doesn't care who we are, where we come from, what our politics are. None of us are going to be safe from this virus until all of us are safe, right? And so there's been a lot of focus on each country turning inwards and looking at its own needs and its own population and its own response. And that's short-sighted, especially when you see countries competing for scarce resources. What we need is a lot more global solidarity and global coordination and collective action. I think the World Health Organization has done a tremendous job with their kind of limited power in trying to engender that, but it's been challenging. And so I think there has to be a lot more coming together. I think wealthy nations need to be able to walk and chew gum at the same time, and that means addressing the pandemic within their own borders, but also understanding that countries in the global south, for example, are going to need more support to be able to also address this, and it's in everyone's best interest that we do so. So I think that there's kind of, if you kind of look at the trend in the rising tide of nationalism around the world over the last couple of years, that only hurts us in the settings of a interconnected global problem like this. And I think we need to strengthen our mechanisms to act in a sort of supranational fashion. And beyond that, I think you could say the same goes true for businesses and civil society all needing to work together.
Okay. Are there anything to add to that, or?
Yes, I mean, one of the features of this pandemic has been the phased approach, through with epidemics in different countries, and in a way that gives us the potential to actually collaborate. So, as one country, for example, now China seems to be working through the worst of the virus from their point of view. They're now starting to help other countries with supplies and medical equipment and things. So I think there's something about us utilising the fact that the virus is sort of COVID is sort of phased throughout these different countries to actually ensure that once the peak's passed, there might be scope for certain countries helping other countries. And particularly in terms of developing countries, the situation in Africa, if they're still moving towards a peak, then there might be scope for developed countries to provide more support there. And I agree with Peter about the fact that it will need countries to turn away from their sort of internal focus and look outward and see what needs to be done to benefit the whole global economy and humanity as well.
Okay, that's helpful. So just a question now about, I guess, rationing that's come in. What is the COVID-19 teaching us about healthcare provision in a ration system? For example, who gets access to ventilators? What can we learn from other countries about this? So there's a question about the rationing debate. Eleanor, do you want to?
Yes. So, I mean, every time these debates about rationing come up and, people refer to sort of quality adjusted life years and some of these sort of issues, they are extremely problematic. And I know that the UK government has looked to put together a sort of a list of those who might be have access to ventilators. And there's been discussions about do not attempt resuscitation statements, for certain parts of the population, and that these have created a lot of controversy. So I think despite the fact we're in a crisis situation, it is very difficult trying to develop these sorts of guidelines, and it's very problematic for doctors and nurses on the front line to then have to try and implement them and try to make these sorts of decisions in very difficult circumstances. So I think it is quite problematic, the rationing decision. And even though there are some guidelines being developed, they are hard and difficult to implement. And I'm not sure about other countries, what they have done in terms of rationing, but Peter, you may know more on that.
First off, I think most health systems ration. right? It's just something that happens. It just happens in a different way, right? Here in the UK, the NHS rations based on sort of cost effectiveness. There's sort of a number at which, a certain cost per disability adjusted life year saved or whatever the NHS is willing to pay, and other things that they may not pay for. That happens commonly in many places. In the US, rationing often happens informally based on ability to pay because there's a very unequal system there. What's different, obviously, about this is that that's not, it's not being done upstream, that this is sort of catastrophe medicine where health workers on the front lines are put in this terrible godlike position of having to decide which of two patients in front of them should get access to life-saving treatment and which will be allowed to die based on kind of survival probabilities. And it's terrible. We've all seen the stories coming out of Italy and Spain in particular, where this has happened. I have in my career been in those situations as well, and it scars you, and that's something that's not going to go away, and that many health workers are going to have to carry with them, and that's just really unfortunate.
Okay. There's a question here about the vaccine. When can we expect to see a vaccine? And could we comment on this? I'm not sure it's a fair question to ask you on that, but any views on that? It's quite a strong theme coming through in the questions.
Yeah, it's a big question, right? So again, probably typically from sort of, new pathogen to vaccine would be 20, 25 years. Really, really fast would be 4 to 5 years. We're now looking at record time estimations being about 12 to 18 months. Being the most likely timeline. It's possible it could be a little bit less. There's been some really interesting work to bypass and sort of compress some of the really important kind of, efficacy and safety testing steps. For example, there's a vaccine being trialed here in Oxford that's bypassing some of the animal testing steps because it's adapted from a different vaccine, which is already fairly well studied. Other thing that's happening, which is exciting, is a lot of investment is being made or committed to take a whole bunch of the best candidate vaccines and build up potential manufacturing capacity for them. Because if tomorrow we had a safe and effective vaccine that was ready to go in humans, we have billions of people who need it, and be able to actually ramp up the manufacturing capacity to do so could take years. And so that's already being done preemptively right now to allow us to get it out there. So that's all exciting. And I think we're going to see something we've never seen before in history. The caution is, this has never been done before. There's never been an effective vaccine against a coronavirus before. So we don't know if it's going to work or how well it's going to work. The second bit is we don't know much about immunity and how much immunity is conferred from infection or the vaccine. Will this give you lifelong immunity if there was a vaccine? Will it last just for a few months or somewhere in between? So there's still a lot of unanswered questions.
Okay. The question that's come in about supply chains, which I think is an important one. Nicholas from the Netherlands asked, what are the best practices in responding to the risks up the supply chain? So any kind of comments on that? Eleanor?
So supply chains are probably not my core area of expertise. But I think one of the challenges with supply chains is that businesses are having to adapt very rapidly and move from one supply chain to another potentially without necessarily having had enough time to really assess what the potential risks are associated with the new supply chain. So it does potentially confer greater risk in terms of that rapid adaptation. But then if it is related to sort of life and death decisions around, can we get adequate drugs or medicines, where we need to, or adequate protective equipment or whatever, then sometimes I think it's weighing up in a crisis situation. You are having to weigh up those respective risks.
Okay. We're nearly out of time, but maybe just a question from me, and it really relates to something Peter you talked about. What are the lessons for other global challenges that we might get from this? I mean, this is indeed a wicked problem. There's no stopping rules. It requires adaptive leadership. It requires curiosity, and requires diverse thought and so forth. But on the upside, what can we really learn from the way in which this wicked problem is unfolding and the leadership responses from it? for other challenges, such as such as climate change, etc. I wondered if we could just end by reflecting on, what are the lessons, the positive lessons that might come out of this for other more challenging problems that we undoubtedly have to face. So, either of you. Peter, do you want to start?
Sure. I think the key word is might, because it's this is a book that's not written yet, and I think what we do in the next months and perhaps year is really going to define this generation, and I think what's possible. Is it going to pull us further apart, or are we going to find ways to come together in ways that we haven't at a global level in a very long time? If we can get through this through global solidarity, coordinated collective action, we're seeing that on the innovation side, on the research and development side. That's where coordination and discovery is happening at a really extraordinary level. Politically, it's not happening yet. If we get this right, we'll be so much better positioned to confront the climate crisis and most of the other grand challenges we face in the 21st century. And so I think there's a roadmap for how we can work better together, and also how we need to rethink some of our systems, our economic systems, our social systems, in ways that are going to allow us to thrive more in an interdependent world in the 21st century. If I may make a plug for those of you who are out there, we've been working here for several months on a new podcast, which launched today, called Reimagine. And in Reimagine, it tackles this very issue. What are the big, wicked problems that we're facing? Climate change, inequality in education, health equity and health security, et cetera. And we're going to look at it through the lens of the way the COVID-19 pandemic is changing the world, and bring in some extraordinary thinkers and social entrepreneurs who think about these things differently. So please do check it out at oxfordanswers.org/podcast. It's called Reimagine.
Eleanor, drawing on your particular research on resilience, I mean, if ever there was a time to think about very critically, how do you build resilience in an organization whilst also being adaptable, can you give us some ideas about the lessons that we might take forward?
Yes, so I think we tend to think a lot, when we talk about resilience, we tend to think a lot about resilience being at an individual level. How do we maintain our own resilience to potential problems and crises? But there's definitely something to think about in terms of resilience, both at an organisational level and to create resilience in a system. And I think one of the what this crisis has shown is that it's important to think about how we think about resilience in a systems perspective, because as we've seen, if you have countries acting in their own interest, whether that's through the way they manage protective equipment or medical equipment, and don't take a sufficiently collaborative approach, then that has a real impact on other countries, in the whole way the global economic system works. So it's really important, I think, to think about how organisations, how corporations, governments going forward act in a more collaborative way, build alliances, and think about how they're going to act in relation to these broader issues like climate change from that perspective. And I think hopefully this crisis has shown that there is a way of acting globally in this sort of urgent situation. And if we can try and take that level of urgency into the climate change discussions and action, then that will be really important.
I think we've probably got time, actually, if I may, one more question that's come in, if that's all right to just discuss with you. From Sumitra: how can countries possibly avoid a second surge before a vaccine is discovered, given that flights and travel between countries can't be suspended? I thought that was worth coming in for. So, Peter.
What we saw with the Spanish flu. 1918 was the first big surge, and there was another wave of infections in 1919. The countries that brought this under control early, that we've talked about in East Asia, are now, as they're beginning to try to relax things a little bit, are starting to see some upswings in the number of cases. Now, a lot of those are imported cases where folks are coming home and bringing the infection in from elsewhere, but we know it's there. at this stage, this virus probably isn't going to just disappear as SARS did and some others have, but is probably going to become endemic and be in circulation. So even in China, where there were 80,000 infections, I believe, in that sort of first wave before it was brought under control, you think about that, that's still a fraction of a percent of the entire population of the country that has been infected and has some immunity. So the vast majority of the population are still vulnerable. So the only ways that we're going to stave off a second surge without staying in perennial lockdown is to have much more aggressive and widespread testing, along with systems for contact tracing, surveillance, and isolation, and ways to be really smart about this. And I think that we've seen these experimentations happen in China, for example, where you're gradually trying to open up little by little in certain bits. It's not like a light switch where you turn social distancing off and back on again, but there are a whole lot of degrees in between, and we need to have a lot more sophistication and nuance in how we kind of dial these things up and down in the future.
Okay. Eleanor, anything to add?
I mean, I agree with Peter. I mean, I think it's going to be a sort of based on geography and sector, in how we're going to come out of the lockdowns, and that's going to take a more, as you say, a more nuanced approach, and better data around testing, better feedback on testing, so that where there's hotspots, they can be contained, but then where there seems to be a downturn, then there can be more relaxed lockdown setup.
Okay, I think we've probably still got time for one more. Roman from the UK asked, do you expect a significant investment in global health in the upcoming years?
I sure hope so.
Yeah, that's what I
One of the real, I think, tragedies in hindsight of SARS and H1N1 and Ebola is that everything was really reactive, much like we were here. And then as soon as the problem goes away, all the attention dries up and the investment dries up, right? There's a lab I know well in Houston that was 90% of the way to developing a SARS vaccine after the SARS outbreak of 2003 to 2004. And eventually they just couldn't get any more funding for it and had to put it on the shelf. If they had finished, because SARS is a close cousin of the current coronavirus, we might be in a very different place. So hopefully this is a wake-up call to say, look, the kind of investment we're talking about, even if it's billions of dollars, is a drop in the ocean compared to the economic cost of what we're currently facing right now. And so the term we're using now for this is global health security. We need to have a global health security agenda, both globally and for every country, and there needs to be a lot of investment in making that a reality.
Okay, so I think, Eleanor, anything else to add? Any final thoughts from both of you? And we've had some wonderful questions. I do apologise to people that we haven't got through all the questions as they've been coming in. But I think, any final thoughts, Eleanor? Any kind of final concluding comments?
Yes, I think we need to be a lot more thoughtful about how we build collaborations going forward, both to tackle this and also to deal with future, current issues like the climate issue of climate change. We've obviously the current setup, capitalist setup is designed to focus on profit and competition. Although there are just beginning to be changes around that. But we need to spend time thinking about how, whilst we maintain that sort of performance, we also manage to build alliances, build collaborations, and look to see how we can sort out these more systemic issues.
Thank you. Peter, any final thoughts?
Yeah, again, this is going to be our defining challenge, and a lot of us are stuck at home and feeling a little bit helpless right now. Remember that by being home, you're helping, but also that all of us has a role to play here, and so find ways to be part of the solution. That can happen locally, supporting vulnerable folks in your neighborhood, supporting your health workers, supporting local charities, doing advocacy with your governments in places where the leadership is not up to scratch. But this is not a time for complacency, it's a time for action.
Okay, thank you. Well, thank you both. Indeed, it's been a very thoughtful intervention and conversation, and thank you again for the questions. Just to say that the next event in this series focuses more on the financial system. So does COVID-19 crisis pose a systemic financial risk? That's on the 14th of April at 2 o'clock with colleagues at the business school. And I think it's just fair to say thank you all for taking part, both again, and to everybody watching, take care, and I hope everybody has a restful break, and I'm sure it's a much needed break. But I'm also conscious, Peter, about this call for action. It's not what you know, it's what you do with what you know that's important. And I think that's the message. So thank you very much, both indeed. And thank you very much for watching. And I hope the series is helping. Thank you.